So thank you everyone for joining this breakout session, which is co-led by the Global Financing Facility and Gavi. My name is Petra Vergeer. I'm the GFF lead for knowledge and learning and results-based financing. And I also oversee our work on monitoring essential health services during the times of COVID-19. And today's discussion is of particular relevance for the GFF, one of the World Bank's largest partnerships and trust funds created in 2015 to support countries as they build equitable and self-sufficient pathways towards achieving universal health coverage. And advancing equity for women, children, and adolescents is really core to this agenda. And in the early days of the pandemic, the GFF sounded the alarm to what we call the secondary health crisis from the impact of the pandemic. And as we feared, there have been significant disruptions to access to essential health services. And looking at data on essential health services among the 36 low-income GFF country partner countries, we are seeing up to a 25% drop in coverage of essential health services last year for women, children, and adolescents during the first wave when COVID started. But the more recent data towards the end of 2020 and early 2021 still shows significant disruptions and further amplifies underlying inequities. And we see that women and girls have borne the brunt of the other secondary impacts of the pandemic, including dramatic increases in gender-based violence, protracted school closures, job losses, and unpaid care. And on average, about 40% of foregone care is due to financial barriers, which is making access to life-saving services such as antenatal visits, vaccinations, SRHR support, and outpatient consultations out of reach. These secondary impacts could reverse years, if not decades, of global health progress and investments in human capital, leaving a generation behind. The GFF moved quickly to help partner countries respond to COVID-19, working in close partnership with the World Bank, WHO, and other global partners, health partners, and governments, and all of you. Our top task has been to identify disruptions to essential health services and adapt and innovate to protect at-risk services for women and adolescents. But there is much more that needs to be done to strengthen health systems that protect and promote equity. And I believe there are several priority actions we can take together. Firstly, we need to sustain a relentless focus on results and use data to inform strategies, identifying who's left behind and why, whether this is geographic areas in a country. We currently see, for example, that it's very much urban areas that are affected by the pandemic, but also systemic weaknesses in the health system are revealed. Sometimes it's certain population groups that are left behind. And of course, including gender responsive monitoring is critical to address gender-related barriers. Secondly, resources will be challenging, both for governments and donors. So we collectively need to prioritize efforts to advance equity, voice, and gender equality, supporting partner countries to prioritize greater efficiency in national health expenditure, stepping up joint advocacy for protecting domestic resources for help, as well as improving donor alignment for priority areas. And then thirdly, we need to work more to reduce financial barriers to healthcare, connecting with social protection and ensuring that those who are already poor that are further affected by COVID, as well as many that will now be more vulnerable as a result of the crisis, are able to access healthcare. And with that, let me now introduce our moderator and panelist. I'm very pleased that with us today are Dr. Amir Aman-Hagos, who is currently a senior advisor at the Global Financing Facility. And many of you will know him as a former Minister of Health from Ethiopia. We also have Stephanie Yeo Guhan, who is the Director of Advocacy with the Association de soutien à l'autopromotion sanitaire et urbaine, ASAPSU, in Côte d'Ivoire. Professor Mark Henson, who is the Director of the Institute of Development Sciences at the University of Southampton. And then the panel will be moderated by Ranjana Kumar, who's the Head of Health Systems Planning, Management and Performance at Gavi. We have about 35 minutes for this discussion, after which we will return to plenary. So let me hand it over to you, Ranjana, so we can get us started. Thank you.
Thank you. Thank you so much, Petra, for the introductions. And it's really great to see lots of familiar names here, and particularly Dr. Flavia, whom we know from her days at WHO and as a Gavi board member. So thank you, Flavia, for joining.
Thanks.
So to everyone in the audience, there are some polling questions which we have posed there. And they talk about, or they mention, the most impactful pro-equity strategies. And there are some choices there, whether it's increased domestic allocation of resources for essential health services, or whether it's creating enabling policies to identify and reach most vulnerable and the marginalized communities, or is it an enabling environment for social accountability to the citizens for pro-equity strategies and health spending? There is no right answer, and there can be a multiple choice as well. So we just wanted to hear from you on your thoughts, and let's get started. So just to set the context, Petra has already set the context, but all the countries have now signed up to the Sustainable Development Goals and the universal health coverage. Yet we see that 15% of children in the poorest economies do not receive a single shot of vaccine to date in their routine immunization, making them most vulnerable to deadly vaccine-preventable diseases. With COVID-19 and the disruption of services, we have seen that routine immunization and the basic health services really take a hit. And Petra mentioned in her initial speech. And the number of zero-dose children are likely to increase. Now let us hear how the government, civil society, academic, and global financing experts and institutions like Gavi and the Global Financing Facility for Global Financing Facility are going to reach these communities through smart financing or smart pro-equity strategies. So maybe we should, I would like to start with Dr. Amir. As a previous health minister of Ethiopia and also a Gavi board member, and now as a senior advisor with the GFF, what strategies should a country employ to promote and protect equity, and particularly as a COVID response while building back the health systems? Over to you, Dr. Amir.
Thank you, Ranji. Good morning, good afternoon, everyone. And I'm very happy to be here. As all of you know, that COVID and the current pandemic is a test for our health systems and health service delivery. And it shows many lessons. And one of the lessons is it showed to almost in all countries that the way that we are doing business is not enough. It showed us many gaps, whether it's about service delivery, as mentioned by Petra, or it's about increasing the inequalities, or showing us how fragile our health systems are in most of the countries. And it also exposed the existing inequalities at the country level by severely affecting the underprivileged one. It's also give us a lesson, an opportunity that to get more attention for health sectors. It should also give us an opportunity to get more political will from health sectors. And it also give us more evidence that health is not only about service delivery. It's as much as social determinants of health are affecting health, health also can affect the social determinant of health, both in positive and negative ways. So it's also an opportunity that many countries are using to increase the health system efficiency, accountability, and others, even though it's not enough. For the last 1.5 years due to this COVID time, we already seen that many countries are trying their best to use this opportunity for better. So COVID is not bringing any inequalities, but it's already exposed. It's already existing inequalities, and it's already increased and exacerbated the effect by severely affecting the underprivileged one. So there are many smart strategies that the countries are currently trying, but I will focus on the major one. I will focus on the two for this special session. The first strategy is that the countries still should have to do better, not only for countries, but also donors or civil societies. And all stakeholders should have to be work hand to hand, is about this genuine, unconditional political commitment. We talked about political commitment in many ways for long years, and some of them are become lip services, some of them are become moderate kinds of effects in our health systems. So we need unconditional and genuine political commitment from all the parties. And this genuine and unconditional political commitment should be supported by increasing healthcare financing, both domestic and international one. We need more resources for health because this COVID already showed us that with the current spending that we are doing at the country level, we cannot build a sustainable health systems at the country level. We cannot address these huge inequalities that's happening in countries. So we need more resources, we need more accountability, and we need more alignment. We need huge political commitment from donors and all stakeholders to use the country system based on the needs, but at least to move on these current movements of alignment. So this political commitment will also help us to move the mutual accountability, and it also helps us to minimize the inequalities if we are using the money efficiently and in an accountable manner. And we also need more community empowerment. We cannot move with only increasing finances and by only doing prioritization at the country level. Even though increasing finance and very high level and effective and also very micro level prioritization is very important to manage the finance to the place that's really needed, to move the resource to the place that's really needed. We also need high community empowerment. This community empowerment will help us first by making the government or all stakeholders to be accountable so that we can minimize these inequalities that's happening, hugely affecting our communities. We also need community empowerment to make sure that the communities are using the platform to its best way to increase the health utilization, to minimize inequalities, and also to use health service delivery at its best effective ways. So the community empowerment and the political commitment are the two most effective interventions that I am thinking the country are still can do better than they are doing right now. And we also want all donors that's working at country level should have to also work on genuine political commitment to increase finances. I know there is a huge difficulties on the physical finance and the whole space are narrowed due to this COVID, but we still need to come up with a solution for that. We cannot abandon anyone. We cannot just let these things to happen to the countries. We already know where the unvaccinated children are. As Ranjas, you know, all the things are already done. We already know where those unvaccinated children are. We already know that girls and adolescents that who doesn't have an access for family planning or service delivery. We already know that people who cannot access any kinds of services, including infectious diseases like malaria, TB, or communicable disease and non-communicable disease. What we need is action. And this action should have to become with huge and high level and unconditional political commitment that can help us move forward, and community empowerment at the lower level that will help us to do mutual accountability and also to channel the services to the people that they deserve the most. Thank you.
Thank you, Dr. Amir. And I like the way that you have proposed a couple of key points. It's not only about unconditional political commitment to increase domestic and donor resources and financing, but also more accountability to the people and community empowerment. So this is the right way. I would like to go to our next panelist, Stephanie. You are very committed to ensuring that the policies and strategies or approaches outlined by Dr. Amir are indeed implemented and the benefits accrue to the people. You are a strong advocate of social accountability and engaged in building CSO capacities. If others could mute, thank you. Thank you for muting, please. Stephanie, you are also a strong advocate of social accountability and engaged in building CSO capacities in Cote d'Ivoire and on budget advocacy to secure financial commitments. Could you please describe how equity is featured in these training programs and what are the initiatives you are taking to ensure social accountability? Stephanie, over to you.
Thank you, Rajana. I just want to tell that we have been trained in the very specific context in COVID pandemic to support our country, improve the way they invest in health. In the regional training of trainer, we are civil society representatives from 10 countries in this joint learning agenda. For in-country training, we have identified the CSOs that they're active in advocacy for health financing and the universal health coverage, but also organizations working in budget transparencies and access to information. In Ivory Coast context, we are working with the different coalition of organizations that are active in public health, all with different mandates and focus areas, but in this program have found a common objective. This is a critical issue when we know the gap of the health system have, which are translating difficulties from people to access essential service. At the end of this learning project, we expect to have a good time to advocate. We will be able to demand improve in the way the budget are used. In the Ivory Coast, out-of-pocket expensive on it represents around 46% of the household budget, which clearly limits access to healthcare depending on people's economic stature. The first of suffer from these shortcomings are adolescents, women, and children. Equity is needed. A key consideration is also our advocacy efforts, as we need to ensure that our country's credit system that focus on the general public and also in the specific needs of included groups. Until the decisions are not taken to benefit the population in an equitable way, service will continue to have gaps in their reach. In the COVID context, we have seen the general response that was not fit for the needs of pregnant women or adolescents. They're not a treated as priority group and just fell under the general treatment that was applied to everyone.
Thank you, Stephanie, for that response and urging on the transparency on budget allocation, and also on your point about seeing that the pregnant women and adolescents seem to be the most vulnerable in this group. I would like to turn to Dr. Mark now. Mark, you are a leading expert on health financing for the betterment of the most vulnerable segment of the population, which is the women and the children. And Mark, I would like to say that you're not only a globally renowned sort of academician, but even in my own household, when I was mentioning about the panel, my daughter replied, "Oh, we had his book at the London School of Economics. We used to use his book." So it's also at our home, you're well known. So Mark, I would like you to tell us something about bringing the international community together post-pandemic through the Venice Expert Forum, and what is the purpose and what are the benefits and what are you advocating for? Over to you, Mark.
Thank you very much indeed, Ranjana. And thanks very much to Dr. Amir and merci beaucoup Stephanie pour votre anglais. I think many of the things I'm going to say echo those things said by the first two speakers. The first thing, as Dr. Amir has made very clear, is that we need to generate political will. And inevitably, when you talk to policymakers, you get the feeling that the first thing that they ask is this a big problem? And do I actually have to do anything about it now? And the answer, of course, to that is yes and yes. And I think that we can see some of the evidence for why maternal, neonatal and child health matters so much, even if we put COVID aside for one moment and just think about the NCD, the non-communicable disease agenda. Children born too soon, too small, or to a mother who's underweight or overweight or has diabetes have somewhere between 1.5 to 6 times greater chance of developing a non-communicable disease later in relation to those who were born at full term with a healthy birth weight or to a healthy mother. Add to that preterm birth rates, which vary from 5 to 15% in various countries. And then add to that the fact that about 10% of full-term babies are growth restricted, and the fact that in many countries, roughly half of pregnant women are overweight or obese. And you can see that about actually 50% of all births around the world are children who are going to have a greater risk of non-communicable diseases later on. Does that make any kind of sense, 50%? Well, yes, it does, when you remember that NCDs account for more than 50% of the mortality everywhere in the world. Actually, 80% of those deaths are in low and middle income countries. So we can see just how powerful early life is. When we add to that the circumstances of early life, we see that actually there are societal and wider impacts as well. For example, if we take a child who's born full term, but in a deprived area in a developed country, his or her likelihood of having a speech and language problem is about the same as a premature baby in an affluent community. So we see the amplification of effects of social stratification. And then, as we've heard, the effects of mental health problems, which are now extremely widespread on emotional development, which is going to lead to chain effects on schooling and lifetime achievement of children. So clearly we have, first of all, the problem of trying to improve political will. Add to that, then, the need to develop a voice, a public voice, and a demand for change. And I think this is where the Venice Forum, which I had the privilege to chair, really advocates some strong initiatives to educate and support prospective parents in preparing for pregnancy, especially in the preconception period of their life course. And that requires novel interventions, not only in schools, but in communities to promote their well-being and their health. And I don't think we should be shy of engaging the media and social media, sometimes we keep well away from them, as promoting understanding and impact, especially in male partners, in men, and of course in the family. The Venice Forum additionally advocates that policymakers really have to get to grip with gender equity through strong commitment to the prevention of violence against women and children, and actually a call for a global treaty against such violence. This really is the only way that we're going to address long-standing social justice, and that means not just gender, but age, ethnic, and other social inequity issues underlying undervalued maternal and child health. Now, COVID has made all these inequities worse, but surely sustainable recovery from COVID gives us the absolute mandate for taking these actions. I don't know whether you want me to turn to some of the other questions, Ranjana, on services, and you mentioned the economy. How are we doing for time?
Thank you, Mark, for that. And we have received the feedback from the polls now, audience poll, and what we can see is that health financing is really very important, but a large segment are asking for, suggesting that we have clear policies for equity led by the government. And I would like to turn to Dr. Amir because a question again goes back to you. You mentioned one of the things that you would like the government and the donors to walk hand in hand, if not shoulder to shoulder. And I just wanted to mention about the Gavi, that the Gavi board has approved additional financing envelope now to really reach the zero dose, the missed communities, and the most marginalized, so that, as Mark has pointed out, they get a head start in life by not only getting access to routine immunization, but all the other services that Mark just pointed out, which really reduces inequities. So Dr. Amir, would you like to come in to say something on creating equitable strategies by the countries?
Thank you, Ranjan. And for those of you who know me, that I am always known as become bold. So I'll be bold for this specific issue because it needs, especially at this point in time. The political commitment that we need, as John, thank you so much for your questions, and Ranji, just to answer both of the questions together. In most areas, as it's mentioned many times, we already know where the inequalities are, be it geographical, gender, or like the wealth quantiles. We already know there still needs more evidence, but we know most of the areas and most of the services that's not happening at the country level. So when we need this political commitment, I'm seeing on two dimensions. The first dimension is to the countries and donors that there's already a will for political commitment, but there is a lack to the means, like evidences. So these are major countries, major donors that we have at the global level and country level. There's also a second aspect of it. There is also intentional non-political willingness due to different reasons, both from countries and donors, due to different reasons that I don't want to go into the details. So our approach should have to be different for different perspectives. For the first perspective, that there is already a will, political will, both from countries and donors, but there's a lack of means or evidence, then we can use all the means to generate more evidences to make sure that there is more finances, both from domestic and international, can move to the healthcare. We can also work with the communities to make real empowerment and engagement so that the communities can do mutual accountability, to create mutual accountability for the government and all the stakeholders. And also all civil societies also have a very big role, both on advocacy, as in work as a watchdogs for the accountability, and also to make sure that they create transparency at the country level. We can also have to see the partnership between donors and countries. For me, I am seeing two poles, two different kinds of extremes. One extreme is to consider this partnership as a country leadership and doing everything the countries are saying as considered as country leadership. The other extreme is to tell the countries for everything and consider that as a country leadership. I think we have to meet at the middle. It takes two to tango, and it needs real partnership, not like letting everything what the country said is not a partnership. It is just like different kinds of relationship. And telling the countries what to do is also not a partnership. So this middle ground is to make sure that when the countries are not doing as they're supposed to do for their communities, I think the partnership, the donor should have to say that, should have to be bold enough to come up with some perspectives, to come up with some red tapes to make sure that the countries are moving on the right direction to support the communities that's really needed. The same is true when the countries are moving on the right direction, and if the donors are not acting accordingly, then there should be a mutual accountability framework that the country should have to make accountable for donors to do accordingly. So that kind of real partnership is needed, especially at this point in time that we don't have much finances due to all the COVID financial crisis that's happening in all over the country. So we need such kinds of genuine kinds of partnership and unconditional kinds of political commitment at the country level for those who have political will. For those there are very few, but those who doesn't have real political view, I think we need special arrangement and we need special kinds of consideration how we can make that happen. And I'll stop by mentioning that there is one initiative that the countries are already started, and this is the alignment working group. that's already commissioned just like 2 or 3 months back, that all the countries are coming hands to hand to make sure that their voice are heard, not only to increase domestic finance and their voice, but also to make mutual accountability between each other. As a colleagues, as countries, there can be mutual accountability to each other, and also mutual accountability with donors, and also mutual accountability with their communities and all stakeholders. So we can create such kinds of platform to make sure that things are going very well, to become more efficient kinds of health services and to reach the underprivileged communities. Thank you. Over to you, Raj.
Thank you, Dr. Amir. So I want to go to Stephanie now, just to say that Dr. Amir said a couple of things like mutual accountability and partnership between donors and countries coming to a middle ground, but also having broader mechanism of accountability. So Stephanie, do you think that CSOs can influence the financing decisions at the country level?
Thank you, Rajana. In the past years, the government has made an effort to give space to CXOs through effective collaboration projects in various areas. As an example, I could mention the National Dialogue, which has identified the responsibilities of each constituencies and allows CSOs and all of government when needed. In addition, we have 2 examples of the platform created with the support of GFF, which allow exchange between different partners and allocation of health investments. Finally, the COVID context have created the new space of collaboration between the government and CSOs, especially on risk communication and prevention. There are not perfect models, but there is room to improve them. Thank you.
Thanks a lot, Stephanie, for your very honest comments. Mark, one final question to you before we can open it up to the audience for any questions that they have, is that we see that the COVID pandemic has resulted in shrinking the fiscal space in several countries, and particularly, those really affected by the pandemic with disruption of services and their economies. So in these sort of countries, what is your message to donors and partners on how they should be supporting these economies and countries where the impact of COVID has been really very, very disquieting? Over to you, Mark.
Thank you, Rajana. To be honest, I think one of the things that came out of the Venice Forum was that we need to really take a new look at the economic models that we're using. They're just not fit for purpose. The truth is that most economic models don't value the unremunerated, financially unremunerated work, which is largely carried out by women, whether it's housework, childcare, agriculture in some places. And if we don't explain to donors and governments the value of this work, and I'll emphasize the word value, we're not going to really come up with the right kind of goals for investment. The OECD, for example, calculates that if you were to include this work, it would increase GDP by somewhere between 15 to 70%, depending on the country. And actually, the Global Burden of Disease study makes it clear that, in fact, GDP is the wrong measure, and that we should be thinking about development and therefore investment in progress with things like the socio-demographic index. There are various others too, which not only talk about productivity in financial terms, but they talk about life expectancy, they talk about years of schooling, they talk about fertility, all the things that affect particularly young girls. And I was very struck by the Reef lectures this year, worth listening to on the BBC channels if you have access to those, because Mark Carney, the former governor of the Bank of England, said that globally we've got to start moving away from economies which are based on human on market values towards things that are based on human values. And I would really urge us to think strongly about how that might change things. I'll stop there.
Thank you, Mark, for that last sort of message that you gave, that economy is not based on human market values, but on human values, is really a very, very powerful statement that you make. We have a couple of minutes. So if anybody from the audience would like to ask a question to the panel. Somebody will have to let me know if there is any hand which is going up. Maybe if not, yes. Flavia, please.
Thank you so much for the great session and for the contribution. As a proud member of the Venice Forum, together with other colleagues, Nina Moody, Linda Giudice, Giancarlo Di Renzo, we would like to pose the question to the other members of the panel. As Professor Hanson has tried to explain, we are reflecting deeply on what should be the contribution of a new investment framework for women, children, and adolescent health and rights, and what could resonate to ensure that those investments are coming, both during the pandemic and after the pandemic, particularly during the recovery part. So the question I have for the other members of the panel is, what are the kind of arguments that they see that we should try to make and carry within this investment framework? And I should add that we are working very closely with the Partnership for Maternal, Newborn and Child Health. As Mark, we become the chair of the Evidence and Knowledge Working Group, but also we would like to work very closely with Gavi, GFF, and other groups that are over time have been very involved in making the case for investment. Over.
Thank you, Flavia, for that. Would any of the panel members like to go first? Maybe Dr. Amir, if we could start with you. So what should an investment framework look like for reaching women, children, and adolescents in the pandemic, but post-pandemic? And
thank you,
how should we make the case?
Thank you, Ranjan, and thank you, Flavia. I think I'll focus on one, even though there are many ways to do that. I want to focus on, as much that we are give emphasis to the quantity of money, to give much emphasis to the quality of money, so to make sure that everything that we are doing is become like sustainable at the country level, and that take us to the alignment agenda, to make sure that all the investment cases that we are doing for women and girls and adolescents at this point in time is a very critical time to work on the real alignment, the real partnership between donors and countries, and also all stakeholders at both global and country level, so that we will not see such kind of devastating effect in the future. So that's maybe one of my intervention. Thank you.
Thank you very much. Maybe I can go to Mark next while Stephanie things up. So maybe 1 minute each, and then I want to hand over to Petra for summarizing the session, with key takeaways. Mark?
Thank you very much. Yeah, I'm really struck by the statement of the Hawaii State Commission on the Status of Women that was published last year on their proposed post-pandemic recovery plan. And they propose some very clear things, and I find it really inspirational. They say that they advocate universal basic income, single payer healthcare, and obviously improving MNCH. And here's a great quote from them. Let me just read it to you. Rather than rush to rebuild the status quo of inequality, we should encourage a deep structural transition to an economy that better values the work we know is essential to sustaining us. We should also address the crisis in healthcare, social, ecological and economic policies laid bare by the pandemic. Doesn't that, to my mind anyway, that says it all, and surely that's a kind of vision that we can all sign up to.
Thank you. Thanks a lot, Mark. Stephanie, would you like to say anything?
Thank you, Rajana. I'm encouraging with that my predecessor have tell for this question. Just tell that please improve the communities in the high level to taken before that the decision. Thank you.
Thank you. Thank you very much, Stephanie. So over to you, Petra, for summarizing and key takeaway messages.
Thank you, Ranjana, and thank you to the panelists for what I found a very enriching discussion. I heard many takeaways, but I'll try and focus on three. Somehow three is always the magic of something that sticks in our mind. So the first one is about, there's currently quite, we heard there is political will to invest more in health. So we should capitalize on that because more money will be needed for health. And we heard about the important role that CSOs can play in this. And it's great to hear about the training that Stephanie alluded to really focus on receiving more resources or getting more health, more money for health. We also heard how important it then is to ensure that the strategies to invest that money in health are appropriate. And Mark alluded to making sure we give children a head start in life. We heard reflections on the importance of community empowerment and thinking through how to rebuild a health system that will be better post-pandemic. So that will require a structural redesign and rethink rather than just building back of what was there. The second point I heard was about the partnership between countries and partners and really together prioritizing and have mutual accountability, building on the current commitments that are there with political will, but also recognizing there are countries where maybe that political will is not strong enough. And this will really require partners and countries together to think through how to ensure that that political will be created for investments in health, as well as sustainable investments in health, to partner shoulder to shoulder, I heard, which I think is a very good terminology. And then third point I heard is on the role of data. And we need to think through, Mark was alluding to the new economic models, thinking about the role of women and all the factors that influence this, to move from this market value to a human value world or economy or whatever we want to call it, but really making that transition. And that will require us also all to reflect on this and really think through where and how to invest so that we build back better. So those are the three key points I took away. And there were many more, as I said, but some that really stuck out with me. So with that, I also think it's been very great to hear different perspectives from Dr. Amir Hagos as former minister, from the reflection from that perspective, as well as now as senior advisor at the GFF, Professor Mark Hansen, who really from his economic reflections, but also his health reflections on how to ensure that we really capture this rightly. And then Stephanie, really, you do your name as Director of Advocacy proud. So thank you for really being clear to us of what we all need to do and where we can all support. Ranjana, I know you're going to take the takeaways to the plenary session. So I would like to welcome you and all other participants to please rejoin at the plenary and have a successful continuation. Thank you very much.
Thank you very much, and a big round of applause to the panelists.
I agree. Thanks, everyone.
Thank you. Bye-bye.
Bye-bye.